Goodwill, changing lives through the power of work.
There are some conversations that you find yourself having over and over, and hopefully they are good ones to be repeated. Our next guest certainly thinks, and rightly so, that her topic this morning bears repeating. Dr. Chelsea Ryan joins us this morning. She is with CHI Memorial's Integrative Medicine Associates up on Signal Mountain. Nice to see you this morning, Dr. Ryan.
Good morning. Nice to see you.
So it's important because you're wanting to focus on the value of lung screenings and lung cancer, who can get them, and then we can't have the conversation without tagging into it how you can actually finally kick the habit and quit smoking. There's a lot to cover this morning.
Yeah, and so one of the biggest things that we need to think about is, lung cancer screening, very important, but the biggest thing to prevent lung cancer is to quit smoking or not smoking at all. But first we'll start kind of with who can get lung cancer screening. And recently, back in March, the USPSTF, which is kind of our reigning force in family medicine, has decreased that age, or found it beneficial to decrease the age of lung cancer screening. So where it was starting at 55, we now start at 50. And people who qualify are those between 50 years old, 80 and 80 years old. And if you have at least a 20-year history, currently smoking, or have quit in the last 15 years. So that's kind of the first thing we do in the office, is look to see, hey, do these people who are currently smoking or previously smoked qualify for that screening? And then we kind of have a risk-benefit discussion with them before we send them for the CT.
There was a time where I would have thought that if you had smoked for 15 years, it would almost be inevitable, one, that you would end up getting this diagnosis, and that two, if you got it, your chances of survival would be very slim. My understanding is that it's no to both of those.
Yeah, and so that's why we have found that lung cancer screening is just such a great thing to include in your annual talk with your patients. If you find lung cancer at lower stages, possible resection or curing those, treating those lung cancers, they're more survivable at those lower stages. And so that's kind of why we really, really push for these things, and at least have the discussion every time we see them each year.
I guess what makes cancer still so scary in all of its forms is how many times we'll hear about somebody who's gotten any cancer diagnosis of whatever type, and they, quote, felt fine. And then they get this diagnosis, and maybe it's somewhat progressed, the disease has. Are there warning signs of lung cancer that you can be watching for?
Sure. So in their later stages, mostly things like coughing up blood, which obviously is alarming to anybody, or shortness of breath. But, if you've smoked for so many years, shortness of breath could be your norm. So it's kind of hard to kind of, notice that those things are different. And, we always have... The lung cancer screening is important, but each year with our active smokers, we talk to them each year, or each visit sometimes, like, hey, are you ready to quit smoking, and things like that, because that risk of lung cancer doesn't really decrease until 10 or 15 years after you quit smoking, and that's why the lung cancer screening qualifications change, because after so many years, your risks do go down, but it's quite a long time, so, don't take up smoking, folks.
Okay, before we talk about quitting smoking, on the lung cancer screening side of things, once you qualify for a screening, is that something that you should have done annually or every 5 years? What's the rule?
Yeah, we do it every year, and so that's one of, benefits. We kind of already covered that. Benefits is finding lung cancer early. But there are risks involved, and so you are committing to an annual screening. So that would be a low dose CT, which has more radiation, obviously, than an X-ray, but lower than a traditional CT. So that's another risk that patients need to understand. But also, what happens when we find something, and so you have to know what you're signing on for. If they do find something, often those pulmonary nodules are just followed up annually, but once they reach a certain size, or they have some qualifications that maybe need a biopsy or a resection, patients need to understand that they're also signing up for potential surgeries or procedures.
Okay, you talk about cessation, because once again, that is easier said than done. People say it's one of the most difficult things you will ever do, is kicking that smoking habit.
Exactly. So there's definitely some medications, but number one is intensive therapy is basically the tried and true way. It's the most difficult way. I think therapy is always more time consuming than taking that medicine. every morning, but pharmacologically, you have medicines such as Chantix, that you see a lot of commercials for, and then you have Wellbutrin, which is actually an antidepressant that is very helpful for quitting smoking. And then you have your more traditional, like over-the-counter rounds, like your patches or your gum or your lozenges. I will say, side note on the gum is I have a lot of patients who will chew and chew and chew and chew the gum when actually you just chew it a couple bites and then park it under your lip. So if anyone's trying to quit with gum, make sure you're reading the instructions right, because I will have a lot of people say, I've used these methods, but they're not working. So make sure you read the instructions how to properly use some of those things.
And let me pause a minute, because you mentioned pharmacologically. I want to point out that you are a DO rather than an MD, and I think that's worth mentioning, because when you're talking to your patients, you're going to bring in all different types of potential options for them.
Yeah, and I mean, I think MD versus DO there's a lot less differences there now than there were when DOs first started. I think that basically now we see the patient, all family medicine, all physicians try to see the patient as a whole patient and not just one diagnosis, and kind of looking at deeper routes. So like, why does this person smoke? Is it because they're really treating their anxiety or depression with nicotine? Things like that. So not just looking at face value, like this person smokes, let them to quit. Let's look at why, maybe, or things like that. So
with getting the lung screenings, is it different right now? I know that hospitals are kind of tightening up again because of the Delta surge with COVID.
Yeah, I think, your annual screenings, and we've learned, I think maybe from this, when COVID first started, is not to skip those annual screenings. I think there were a lot of, I don't have numbers, but I think, your routine PAPs and breast cancer screenings and lung cancer screenings and colonoscopies, I think there were probably a lot of diagnoses that were found later on that may have been preventable or treated early. So, I think don't skip these interventions because they're going to happen whether, in your body, whether COVID's there or not. And the earlier that these screenings detect something, then the earlier they can be treated. So
the Memorial family is quite large, so I might be asking you something that you can't answer specifically, but you do have, through the hospital, the mobile lung screenings. Are they up and running?
They are. I don't have a date for upcoming here next, but we'll be advertising that soon. We just had one maybe last month, and those are super helpful. I mean, living on Signal Mountain, I know how tough it is to drive off. You're kind of spoiled up here when you don't want to leave the mountain, and so that has been really helpful in getting not only our patients from here up in Signal Mountain, but Dunlap and the surrounding areas where they don't have to go down where maybe they're a little bit scared to go to the hospital with COVID going on. So that's been kind of helpful too.
Well, it is always a joy to talk to you, so thanks for carving out a few minutes of your morning with us today.
Anytime. Have a great day.
And if you are looking for a family physician, as you heard her mention, that is what her practice is all about. You can find her on the mountain on Taft Highway. It's Integrative Medicine Associates. Their phone number 886-2004. You can also find her online, chimemorialmedicalgroup.org. We're back after this.